What if your body has been trying to warn you for months, and you had no idea? Every single year, over 60,000 people in the United States alone are diagnosed with pancreatic cancer. And here's the part that breaks my heart. Nearly 90% of them are diagnosed too late. Not because the symptoms weren't there. They were. But because those symptoms looked like something else entirely. Heartburn, fatigue, back pain, a little bit of weight loss. That's why pancreatic cancer is called the silent killer. Not because it's quiet, but because we're not listening to the right things. Today, that changes. In this video, I'm going to walk you through 13 of the most dangerous warning signs of pancreatic cancer, including 3 that almost nobody talks about, and the ones that even doctors sometimes miss on the first visit. Stay until the end, because symptom number 11 might be the one that saved your life, or the life of someone you love. So why is pancreatic cancer so deadly compared to other cancers? Great question. Here's the honest answer. The pancreas sits deep inside your body, tucked behind your stomach, near your spine. You can't feel it from the outside. A doctor can't easily examine it with their hands. It doesn't show up on a regular physical. And unlike breast cancer, where a lump might be felt, or colon cancer, where routine screenings can catch things early, the pancreas gets almost no early screening. Simple animation of body showing pancreas location. There's no standard blood test, no routine ultrasound, no early warning system. So when symptoms finally show up clearly enough to worry someone, they usually mean the cancer has already spread. The 5-year survival rate for pancreatic cancer is only around 12%. 12%. But here's what we also know. People who are diagnosed early have survival rates close to 44%. That's almost 4 times better. That gap. That's what early knowledge does. That's what this video can do. So let's get into it. 13 warning signs. Pay attention. Symptom number 1, jaundice, yellowing of skin and eyes. Number 1, and this is the most commonly known sign, jaundice. Jaundice means your skin and the whites of your eyes start to turn yellow. It can also make your urine look dark, like the color of tea or cola, and your stools, your poop, may turn pale or clay-colored. Here's why this happens. The pancreas sits right next to the bile duct, a small tube that carries bile from the liver into the small intestine. When a tumor grows in the head of the pancreas, it can press on that bile duct and block it. Bile backs up into the bloodstream, and you turn yellow. Now, jaundice can have other causes, liver disease, gallstones, but jaundice that appears without pain is a major red flag for pancreatic cancer. Never ignore it. Symptom number 2, unexplained weight loss. Number 2, sudden, unexplained weight loss. I'm not talking about losing weight because you started going to the gym or changed your diet. I'm talking about losing 10, 15, 20 pounds without trying, without changing anything. With pancreatic cancer, this happens for a few reasons. The tumor interferes with digestion. The body can't absorb nutrients properly. The cancer itself consumes energy, and the body goes into a kind of survival mode where it starts burning through muscle and fat. Most people, honestly, feel happy when they lose weight. That's the danger. This is one symptom people often overlook for months. If you're losing weight without a clear reason, take it seriously. Symptom number 3, abdominal or mid-back pain. Number 3, persistent pain in the abdomen or mid-back. This one gets dismissed constantly. People chalk it up to muscle strain, sitting wrong at their desk, or sleeping in a bad position. But with pancreatic cancer, the pain has a specific pattern. It often starts in the upper abdomen and radiates around to the back. It may be worse after eating. and it may get a little better when you lean forward. This happens because the pancreas sits near major nerves in the back of the abdomen. As a tumor grows, it presses against those nerves. The key word here is persistent. Everyone gets a sore back, but a dull, constant ache in your upper abdomen or mid-back that won't go away. That needs a doctor's visit. Symptom number 4, new onset diabetes in adults over 50. Number 4, and this is one of the most surprising ones, a sudden new diagnosis of type 2 diabetes, especially in people over 50 who have no family history and aren't overweight. Here's the science. The pancreas makes insulin. When a tumor damages the insulin-producing cells, blood sugar control goes haywire. Diabetes can show up. Now, this doesn't mean everyone with diabetes has cancer. Of course not. Diabetes is incredibly common. But research shows that a significant number of people diagnosed with pancreatic cancer had recently been diagnosed with new-onset diabetes, often within the year or two before the cancer diagnosis. So if you're over 50, suddenly develop diabetes, and don't fit the typical profile, no family history, not obese, ask your doctor to also investigate your pancreas. That small question could matter enormously. Symptom number 5, loss of appetite. Number 5, loss of appetite. Not just not feeling hungry one morning. A deep, lasting disinterest in food. Some patients describe feeling full after just a few bites. Others say food starts to taste wrong or smell unpleasant. This happens partly because the tumor disrupts digestion, and partly because the body redirects its energy away from normal functions. When combined with other symptoms on this list, unexplained loss of appetite is a warning sign that should never be brushed aside. Symptom number 6, nausea and vomiting. Number 6, nausea and vomiting. Again, on its own, everyone feels nauseous sometimes. But with pancreatic cancer, nausea tends to be persistent and often gets worse after eating. In some cases, the tumor grows large enough to partially block the stomach or small intestine, making it difficult for food to pass through normally. This causes nausea, vomiting, and a general feeling of fullness. This is often mistaken for acid reflux or irritable bowel syndrome. People take antacids for months and feel temporary relief, while the real cause goes undetected. Symptom number 7, changes in stool. Number 7, and people don't like talking about this one, but it's important, changes in your stool. Specifically, greasy, oily, pale, or floating stools, sometimes accompanied by a particularly foul smell. This happens because when the pancreas isn't producing enough digestive enzymes, which is common when cancer is present, fat can't be properly absorbed. It passes through the gut undigested and shows up in your stool. In medicine, this is called steatorrhea, and it's a meaningful clinical sign. Also, as mentioned with jaundice, pale or clay-colored stools can indicate bile duct blockage. Don't be embarrassed to look. Your stool can tell you a lot about what's happening inside your body. Symptom number 8, itchy skin. Number 8, itchy skin. And not just a little itch. Deep, relentless itching, especially with no rash visible. This is directly tied to jaundice. When bile builds up in the bloodstream, bile salts are deposited under the skin, and bile salts are incredibly irritating to nerve endings. Patients describe it as itching from the inside, where scratching brings zero relief. If you're experiencing unusual skin itching along with any yellowing, even mild, please see a doctor promptly. Symptom number 9, digestive problems and bloating. Number 9, persistent bloating and digestive problems. The pancreas produces enzymes that help break down food. When a tumor interferes with enzyme production, digestion becomes difficult. Gas, bloating, discomfort after meals. These become a daily pattern. Many people mistake this for food intolerance or IBS and spend months eliminating foods from their diet without any improvement. The key here is duration and consistency. If your digestion has been off for more than a few weeks and nothing seems to help, it warrants investigation. Symptom number 10, fatigue and weakness. Number 10, deep, persistent fatigue. Not the kind of tired you feel after a long week of work. A bone-level exhaustion that doesn't go away with sleep. A fatigue that makes normal daily activities feel heavy and difficult. Cancer is metabolically demanding. It consumes resources. Combined with poor nutrient absorption and the body's immune response to the tumor, extreme fatigue becomes a hallmark symptom. But fatigue alone almost never leads to a cancer diagnosis, because fatigue has hundreds of causes. It usually takes a combination of symptoms before someone connects the dots. That's why this video matters. You need to see the full picture. Symptom number 11, blood clots, deep vein thrombosis. Number 11, and this is one most people have never heard of, blood clots. Music emphasizes this moment. Change in tone. Pancreatic cancer has a well-documented link to blood clots, deep vein thrombosis, or DVT. This is when a clot forms, usually in the leg. The leg becomes swollen, red, warm, and painful. In some cases, this clot can travel to the lungs, causing a pulmonary embolism. That's life-threatening. Here's the shocking part. For some patients, a blood clot was their first sign that something was seriously wrong before any abdominal symptoms appeared. Researchers believe pancreatic cancer releases substances that make blood more likely to clot. It's called Trousseau syndrome, a clotting disorder associated with hidden cancers. If you develop an unexplained blood clot, especially if you're not sedentary and don't have other obvious risk factors, ask your doctor to look deeper. Symptom number 12, depression and mood changes. Number 12, this one is going to surprise you. Depression. Studies have found that depression and anxiety sometimes appear months, even years, before a pancreatic cancer diagnosis. At first, scientists thought patients were simply reacting emotionally to being sick, but the timing didn't match. People were developing depression before they had any obvious symptoms, before any diagnosis. The current theory? Pancreatic tumors may release chemical substances, hormones, and other molecules that affect brain chemistry directly. Or it may be related to how the body's stress response reacts to the cancer's presence. Now, depression is incredibly common and has many causes. I'm absolutely not saying depression means cancer. Please hear me on that. But if someone develops significant depression without a clear life trigger, especially combined with physical symptoms like weight loss, abdominal pain, or fatigue, it's worth a comprehensive medical evaluation. Symptom number 13, sudden changes in diabetes control. And number 13, sudden difficulty controlling blood sugar in people who already have diabetes. If you've had type 2 diabetes for years and it's been reasonably controlled with medication, and suddenly, with no major changes in diet or lifestyle, your blood sugar goes wild and your medication stops working as well, this is a red flag. As we discussed, the pancreas is the insulin factory. When cancer damages more of that tissue, insulin production becomes erratic and unpredictable. Endocrinologists are increasingly trained to watch for this pattern because it can be an early warning sign. If your diabetes suddenly gets harder to manage, tell your doctor. Ask about your pancreas. Shocking facts. All right, before we wrap up, I want to share some facts about pancreatic cancer that really put all of this into perspective. Fact 1. Pancreatic cancer is the third leading cause of cancer death in the United States, and it's on track to become the second. Not because it's getting more common, but because survival rates for other cancers are improving while pancreatic cancer lags behind. Fact 2. The pancreas has two completely different jobs in your body. The exocrine part makes digestive enzymes. That's where most pancreatic cancers start. The endocrine part makes hormones like insulin. Two very different diseases can arise from the same organ. Fact 3. Smoking is the single biggest lifestyle risk factor for pancreatic cancer, doubling or even tripling your risk. Chronic pancreatitis, obesity, and a family history also significantly raise risk. Fact 4. The surprise. A study published in medical journals found that in many pancreatic cancer patients, subtle signs appeared an average of 6 to 12 months before diagnosis, but were either ignored or misattributed to other conditions. 6 to 12 months. That's potentially a window that could save lives. Fact 5. There's no widely available screening test for pancreatic cancer, but high-risk individuals, those with a strong family history or certain genetic mutations like BRCA2, can be enrolled in surveillance programs. If pancreatic cancer runs in your family, ask your doctor about genetic counseling. So what do you do with all of this information? First, don't panic. Most of these symptoms, taken individually, have many ordinary explanations. Jaundice, back pain, fatigue. Each of these alone is usually not cancer. But, and this is critical, a combination of these symptoms, or symptoms that persist and don't have an obvious explanation, is your signal to see a doctor and push for answers. Here's your action plan. 1. Know your risk. If you have a first-degree relative, a parent or sibling, who had pancreatic cancer, your risk is higher. If you smoke, quit. If you have chronic pancreatitis or carry a BRCA gene mutation, talk to a specialist about surveillance. 2. Trust your body. You know your body. If something feels different, persistently different, don't wait for it to get worse. Make the appointment. 3. Be specific with your doctor. Don't just say, I feel off. Say, I've had upper abdominal pain for 6 weeks that radiates to my back. I've lost 12 pounds without trying, and my appetite has decreased significantly. The more specific you are, the better your doctor can investigate. 4. Ask for imaging if appropriate. If you have a combination of symptoms, ask whether an abdominal ultrasound or CT scan might be warranted. You are allowed to ask questions. You are allowed to advocate for yourself. 5. Share this information. Share this video with people you love. Sometimes the most important thing you can do is make sure the people around you are informed. Pancreatic cancer is hard. The statistics are real. But early detection does matter. Knowledge matters. And the fact that you watched this video, that you cared enough to learn these 13 signs, that matters. You could be the reason someone you love gets checked out sooner. That's not a small thing. That's everything. If this video gave you something valuable, a fact you didn't know, a sign you'll now watch for, a conversation you're going to have with a doctor or a family member, then I'd really appreciate it if you hit that subscribe button right now. Every week, we cover health topics that matter, the kind of information that doesn't always make it to your doctor's waiting room. We break down complex medical science into language that real people can understand and actually use. And if you found this video helpful, please share it with your parents, your friends, your family group chat. You never know whose life might be changed by a simple piece of information. Coming up next, we're covering the early warning signs of ovarian cancer, another silent cancer that's too often caught too late. Click on that video and let's keep learning together. Take care of yourself, and I'll see you in the next one.